are going to go through looking at the appendicular skeleton, which is exercise 10 in the lab book on page 147, so you want to follow along with your lab book. We're going to be looking at the bones of the appendicular skeleton. When we talk about the appendicular skeleton, this is the skeleton that makes up the appendages or the limbs of the body. So I have my trusty sidekick here who's going to help me out for this part. We're going to start off with the upper limb. When we look at the upper limb, we're going to look at the bones both articulated, so on the skeleton, and also disarticulated. So we're going to start off with the pectoral girdle, and the pectoral girdle are the two bones that attach the upper limb to the body. The first of these is the clavicle, which you can see here. The clavicle is this fairly small, doubly curved bone. It has two ends that are slightly different in the way they are organized. So this blunter end here, this is the medial end. This goes towards the center line of the body, and it actually articulates here at the sternum. Right? It creates what's called the sternoclavicular joint, and that sternoclavicular joint is the only bone-to-bone connection that we have that actually holds the upper limb or the pectoral girdle in place. The clavicle then has a lateral end, and the lateral end is much more flattened. There's actually a little divot here. Okay, you can actually see right where my finger sits, there's a little divot, and that divot is called a facet, and that facet is going to articulate on a particular part of the scapula, which would be commonly called the shoulder blade. There's a projection that comes out that is called the acromion, and that's where the clavicle would articulate. When we take a look at this, I'm going to turn this skeleton around so we can see the dorsal side of things. Here would be the clavicle on this side, and then on the back over here we'd have the scapula. These two bones together create the pectoral girdle. Now we take a look at the scapula more in depth, and what we see here, we have this roughly triangular shaped bone. What we have, there's a curved in edge. You can see that this curves in. That's going to sit on the rib cage. It actually sits at a little bit of an angle. This part where we form this opening, you're going to see I can stick my fingers right in here. That is made of what's called the coracoid process, the acromion, and the glenoid cavity, the glenoid fossa. This is going to form a little notch, and here is where the head of the humerus will sit. This curved in region, that is the subscapular region. On the back, the posterior aspect, we have the spine that runs along, and that spine continues up and creates a projection called the acromion. So when the clavicle and the scapula are articulated in situ, in position, the clavicle will articulate with the acromion, excuse me, I dropped my clavicle, with the acromion of the scapula. Kind of like this. It's a very loose connection here. So then returning to our articulated skeleton, we have the next bone is the humerus. The humerus is the single large bone of the arm, the upper arm, okay, what is called the brachium. Here we have the humerus. I'll take this out disarticulated. The humerus has this extremely rounded head. The rounded head. Then there is a very clear line where the neck would be, followed by this narrowing, and this is a typical long bone. Right? I'll hold it back so you can see the entirety. Right? This is a typical long bone. Right? So we have a very clear diaphysis with two epiphyses. If we were to section this, right, we would see that this would be all compact bone with a medullary cavity inside. Here we would have the spongy bone in the two areas of the epiphyses. Where we see articulation here, this would be our scapula, and the humerus sits in this little notch. Now you notice this isn't a terribly tight bone-to-bone connection here, and that's one of the things that gives our upper limb so much movement, and you'll have to compare that later to what we see when we look at the lower limb. So this is the proximal head. Let's move over down to the distal side of the humerus. This is where we're going to see the articulation of the humerus, the single bone of the arm, with the two bones that make up the forearm, which will be the radius and the ulna. Now in an articulated skeleton, this forms what we would call the elbow joint, and there's two main kinds of movements that we'll see here when we look at the joint itself. Okay? We have the flexion and extension. We also have this rotation that can occur, which is called pronation and supination, and we'll talk about that a little bit more when we look at some of the joints. So the two bones that are going to make up the forearm are the ulna and the radius, and we'll take a look at those separately. The ulna has this notch in it. It's called the trochlear notch, and it actually makes a little U shape. That's how you can remember it is the ulna. The way the ulna sits in the humerus is there is a little notch called a trochlea. Right? So the trochlear notch sits into the trochlea, and it forms this nice pivot joint. There are two processes here. We have the olecranon process and the coronoid process, and these go into the coronoid and olecranon fossa respectively. Okay, so if you look close, you can see how this moves in. The second bone of the forearm is the radius. The radius has this much more flattened appearance. It sits on the humerus at this much more rounded area, rounded condyle called the capitulum. And the way the radius sits is it actually has the ability where it can rotate on its axis. Now the radius and the ulna do articulate together. It's a little bit more difficult to demonstrate with these disarticulated bones because we're lacking the soft tissue structures that actually hold them together nicely, but they roughly interact like so. Now when we take a look at this on the articulated skeleton, it's much more easy to see, where we have the radius and the ulna. The radius runs along the thumb side of the arm, so if you were to look at your own arm, where the thumb is, this is where your radius would run. If you turn your hand the other way, pinky runs down to the ulna, and you can tell this because you can actually feel the ulna all the way to the point of your elbow, which is that olecranon. Okay? And if you're very gently, you can feel when you move your elbow, you can feel that. And we'll see that more when we look at the joints. On the distal ends, both the radius and the ulna have these little processes that come off. Okay, these are each called a styloid process, the styloid process of the ulna. And notice the ulna is much smaller on this end. Here is the radius. This would be the styloid process of the radius. These two would interact like so, and they basically create a little bracket. And this little bracket is going to allow for the bones of the wrist to sit in. It is where we'll have the true bones of the wrist sitting, and those are called the carpal bones. So if we take a look at the hand, we have these row of 4 and 4 small cube-shaped bones. Those are the carpals. The bones that make up the actual hand, the palm, those are the metacarpals. And then finally we have the phalanges. Each of the fingers has 3 phalanges. Singular, the bone is called a phalanx. So we have the proximal, middle, and distal phalanx. With everything except for the thumb has only 2 phalanges. If we move on, then we're going to move to the bones of the lower limb, and we're going to look at the pelvic girdle. And for this one, I'm going to actually use a much smaller skeleton. It's a bit easier to demonstrate. It's a desktop size, so this is not anatomically the correct size, okay, but it does help a bit in terms of being able to see this on the video. So if we take a look at this, this region here, these are the coxal bones, also called the innominate bones. They are paired. There are 2 bones, and these are going to form the pelvic girdle. Now what's unique about the lower limb and the pelvic girdle is the pelvic girdle requires the interaction with the axial skeleton. So if you, from the previous videos, when we looked at the axial skeleton includes the vertebral column, and the base of the vertebral column here is the sacrum. So the actual pelvic girdle is the sacrum as well as the 2 pelvic bones. Now if we were to take a look at a single pelvic bone disarticulated, this is what we would see. It has a fairly unique shape, whereas there's movement in one plane that would come around, and then the other plane. Right, there's this very large fossa here. This is called the acetabulum. This is where we'll see the head of the femur articulating. This area of here, this is the pubis. The pubis comes around and forms the pubic arch when we have the 2 bones together. In the back, this rounded, kind of thick bone here, this is the ischium. Right? This would be the bone that if you sat, you would basically sit on. This wing up here, this is the ilium. You can see there's a curve. These bones sit almost in opposite directions to one another. So what we have here then, we have an articulated pelvis, where you can see the 2 coxal bones together. Here at the center, this would be the pubic symphysis. This is a specific kind of joint that we'll see in the next chapter. The opening here, this is the obturator foramen. And then on either side, we have the acetabulum, and this is where the head of the femur will articulate. We also have from the axial skeleton the sacrum as well as some of the lumbar vertebrae. So this is what the pelvic girdle in its entirety would look like. The bone then, the single large bone of the upper part of the leg, or the thigh, is the femur. I'm going to hold this back. This is quite a large bone, so I need to move it quite a bit back in order for you to see the entirety of it. It's quite a large bone. It is the largest bone and the strongest bone in the body. If we look at this region here, this very rounded head, this articulates with the very rounded acetabulum, and this is what gives us movement of our hip. We also have these large bumpy areas. Okay, this is called the greater trochanter. Along this edge here is where we have important ligaments attaching that hold the femur into place in the hip. We also have the site of very important muscle attachment. Here we have a slight curve to the bone, and that actually helps to make it stronger. And then finally, over on the lower end, or the inferior end, we have two condyles, and these two condyles will form the knee. And we'll take a look at the knee in depth. It's one of the joints that we'll spend the most time looking. Right? But you can see we have these very rounded areas that are the condyles, and in between we have this dip, which is called the intercondylar fossa. And that's going to be important in how the knee holds together. So the femur sits on top of the tibia. So this would be the bone of the tibia. This would be the bone of your leg, the lower part of your lower limb. There are two dips here, and this is where you would have each of the condyles sitting. That would allow for this movement of the knee. This is a fairly thick bone as well. If we follow this down towards the very end, we have half of a little notch, and we'll see that this is going to form an important bracket for the ankle. Here we have what's called, what we say is the medial malleolus, or medial malleolus. It's going to form part of the ankle bracket. The other bone is the fibula, and the fibula is a much thinner bone. As with the radius and ulna in the forearm, in the lower part of the leg, these two bones articulate together, and where they articulate forms the ankle. Now we'll move back to our small model so I can show you this a bit more in situ. So here we have the os coxae. This would be our much more reduced small femur. The knee is where we would have the bend, and then finally if we look at the tibia and the fibula, you can see that the tibia and the fibula articulate with one another, and they're going to form the area where the ankle sits. So here's where you would have the foot. You have the tibia and the fibula. Now the foot itself, the bones of the true ankle are called the tarsal bones. Right? There are 7 tarsal bones. The largest and the thick one back here that you walk on that would be your heel is the calcaneus. Where the tibia and fibula articulate, right, that tarsal bone is called the talus, and that's what's going to allow for this dorsiflexion and plantarflexion movement. In addition to the tarsal bones, we also have the metatarsals and the phalanges. We use the same term for the bones of the foot. Now the final bone that's involved in the lower limb is the patella. The patella is a very small bone, and we'll discuss the patella in depth when we look at the joints. And just for your own edification, you can see that here would be the patella, and it sits in part of the knee joint.